Okay, we're going to pivot from the topic of wellness to the very interrelated topic of climate change in health, and how we prepare for what is real today and what is to come tomorrow, and adapt for that. I'm delighted to welcome here to the stage Dr. Vanessa Carey, who among her many hats is the CEO of C Global Health, which is a nonprofit focused on healthcare, workforce training, and system strengthening, and of course is now the special envoy for climate change and health for the WHO. So thank you so much, Dr. Carey, for joining us here today. As we only have 15 minutes, we're going to jump right into the questions. We'd love to have more time to talk about all these type of things. One of the issues that we hear all the time is a sense of urgency when we talk about climate change, and particularly its impact in health and the work that you've done through SEED and elsewhere. You've seen this firsthand and how it impacts the population overall, how it impacts those frontline workers, which we'll get back to here very shortly. Talk about that sense of urgency and what maybe we need to do different in selling the argument of how important health is part of this equation, and really what we need to combat this.
Well, thank you, and thank you very much for letting me join you this morning. It is a pleasure to be here to talk about this, because I think that, the climate crisis is a health crisis at the bottom line. It is how we experience the climate crisis through our health is the human face of how we're experiencing it, whether it's extreme weather, extreme heat, whether it is the air pollution that kills 7 million people a year. That is one person every 5 seconds. Somebody just died. We are literally talking about our survival right now through climate change. And so there really is an urgency to this. And health is fundamental to, I think, responding to the climate change crisis, but also it's fundamental to everything we're trying to do in our world. It turns out that when populations are healthier, you have a more productive workforce. The US is spending $100 billion annually just in lost productivity from extreme heat. That's going to double over the next decade. So it has economic consequences, it has security consequences. There's going to be 1.2 billion climate migrants between now and 2050. It has gender implications where women and children are more impacted by the effects of climate change. And so we're really talking about something that's impacting every piece of the fabric of our society. Now, I just put out a message of doom and gloom. There's actually a lot we can do about it. And this means there's a lot of change and wonderful things we can also create if we start to take a health-centered approach to climate change.
Yeah, so let's talk about that, and that health being a linchpin that brings everybody together, both from a value perspective and the value that cascades through society, as well as a human element, that we've gone through a terrible experience of pandemic, and we recognize the importance of health in society. Talk about that health-centric approach and the examples of how that is already bringing people together to really target this issue.
Absolutely. I think the best way for me to talk about a health-centered approach is through the work that we do at SEED Global Health. So SEED Global Health is an organization that partners with governments in sub-Saharan Africa to build out a healthcare workforce that can meet the challenges and burdens of disease in these countries. And it's really with this idea that health is a human-centered intervention, right? We can rely on AI and technology, but that doesn't hang the bag of blood when a woman is hemorrhaging in childbirth. So we have partnered with governments in sub-Saharan Africa to meet their big priorities. One example would be in Zambia, where we've been training family medicine physicians. Turns out that family medicine physicians can actually care for 80% of the healthcare problems that we face. They can deliver babies and do maternal health. They can deliver vaccines and take care of children. They can do mental health. They can do non-communicable disease. They can treat malaria and vector-borne diseases. And so by partnering with the government of Zambia, we've been able to build out a whole new generation of family medicine physicians in the pipeline that will then become a backbone of the primary care delivery system. We did this in Malawi. And we've been supporting family medicine in Malawi such that when cholera hit, which came from a huge number of tropical storms that have hit southern Africa in recent years, and it led to the worst and longest outbreak that the country's ever seen in its history, such that schools shut down, the president and government stopped traveling to help manage the crisis, tens of thousands got sick and thousands died. We were able to pivot to help treat cholera. But we also, when the bridges were washed out from Cyclone Freddy, and the birthing units can no longer be accessed in certain parts of the country, we were able to help train staff to stand up new birthing units so women could deliver safely. So we've seen the flexibility to move or to use ultrasound to diagnose COVID in the absence of tests. So when you do a well-trained health worker, you can not only address the burdens of disease coming from climate change, but actually you can address the burdens of disease that we're seeing today. And we know it has a profound impact on human health. The final example I'll give is in Sierra Leone. We partner with the government of Sierra Leone to build a national midwifery training program. We've been working in our district as the only partner really in partnership with the local institution and the government. And this is a country that has the highest maternal mortality rate in the world. 50 times the likelihood of dying in childbirth than in the United States where I am from. And through just education, training, and looking at needs assessment of why women are dying and training towards it and doing some basic infrastructure investments, we had 0 maternal deaths for the first 5 months of this year. That's a collective we with our Sierra Leonean partners, right? They've really been on the front line of this, and we've been in service to their priorities. So it is possible, but we have to decide that is our ambition, and we have to decide that that is what this moment commands, and it does. We are living in a really existential time when you look at what's happening in the world today. And I deeply believe that investments in health that give people the opportunity to thrive, to care for their families, to go to work, to live their lives, can be very critical, I think, to starting to close the big equity gaps and to bringing us to a better place that responds to climate change and that responds to some of these crises we're seeing today.
So let's break down some of these kind of system resilience aspects you talked about, and particularly there was a session earlier on talking about healthcare workforce, those people at the front lines, and helping them adapt to the things to come. How do we prepare those individuals and then kind of the broader ecosystem of people who are part of that care, people at the community level? How do we prepare them for what is to come in climate change and health?
Well, I think it's a great question. I am a healthcare worker. I'm a physician, and actually only just gave up my clinical practice this year, and reluctantly. It's quite a privilege to do that. But I think that as we look at what's coming down the pipeline in climate change, we look at what's coming from any disease burdens, right? We are losing the battle now against a lot of the SDGs in progress. Maternal mortality has gone up in the wake of COVID. We are seeing increased mortality from cancers. 90% of services got disrupted in COVID. And part of that was because there was not enough healthcare workers available to manage existing disease, let alone the new diseases that are coming. That's what we're facing in climate change. So it starts with investing in a fit-for-purpose workforce that goes from the community health worker to the definitive care that can be provided, and making sure that that health workforce is recognized, has the tools of the trade that they need, that has the support and is paid well and is protected, right? I mean, even in the United States where I worked in ICUs, we were reusing masks for weeks in order to preserve the PPE. We have to be thoughtful about what it takes to deliver services, and we have to prioritize healthcare and see it not as a cost, but as an investment. And I think for policymakers out there that need some incentive, there's actually $2 to $4 in return on investment for every dollar spent on health, seen over generations in terms of a healthier population and productivity and the things that can be surmounted. We know that if we spent $1.30 per person on this earth for a pandemic responsive system that would have prevented many of the effects of COVID, that's $10.5 billion for our population today. We would offset the trillions we've spent to react. But for me, it does very much start with healthcare workers, because we are the backbone of strong healthcare systems. We can leverage the tools that are available. We can call for more. We can recognize problems. But most importantly, when someone is dying, we can help them die out of pain and with dignity. We can be the ones that hang that bag of blood. There is no way to deliver healthcare without that healthcare workforce, and yet it's something that we have for far too long abandoned, and there is no way we are going to address this rising burden of disease from climate change unless we really build out that workforce. And for the record, it's job creation, it's gender equity. 70% of jobs in healthcare are women. 90% of patient front-centered jobs or facing jobs are women. It's a key to employment in countries where populations are rising, like sub-Saharan Africa. So if you're not convinced yet, invest in the healthcare workforce. It's really key.
And I suspect listen to that workforce as this evolves over time. It's not a static issue. An adaptation and hearing those people that are the front lines are seeing that impact and that cascade effect that go beyond the air pollution, the things that we know today at climate change, the evidence to come, listening to them is going to be really very critical.
It is going to be critical, and I think all healthcare workers have to be prepared to understand the onslaught of what's coming and to be able to prepare patients to know how to protect themselves and to build resilience and to stay safe in the face of extreme weather. And so we're in a really evolving world that, that we should see that as an opportunity, though, to rise to that challenge. And I think we can. We have all the tools. It's really a choice. It's a choice that we have to make, and one that I'm hopeful everybody in this room can help encourage as we go forth.
So talking to some of the people in the room here coming from the private sector, this cannot be done in silos. It really has to be a different level of collaboration with shared values and goals. What is the message and the role of the private sector, and maybe some examples of what you've seen already where people are starting to mobilize and being part of the bigger picture, where there's values from their business organization, there's values to society?
I think without question, every single kind of sector is going to have to be a part of this solution, especially in the health and climate nexus. And the private sector has a huge role to play. You will be the accelerators of how quickly we can move. You also can be the value shift that we need, I think, for this world today. Because at the end of the day, we cannot live anymore by an economic bottom line. This is not just about shareholders, it's about stakeholders, and that's every single individual on this earth, whether you have access to money and power or whether you don't. And I think that the private sector has the ability, both in terms of their internal practices, how they invest in health, they invest in a healthy workforce, they make access to care available to their employees, and they prioritize that. They educate their employees on their individual behaviors, and ability to focus on prevention makes a big difference. But the private sector can also lead by example and help drive government and others to think differently. I think a terrific example that we just saw coming out of the UN General Assembly is the French pharmaceutical company Sanofi. Just announced a 450 million euro commitment to get to net zero in their own operations by 2030, and another 40 million euros to help vulnerable communities adapt to climate change. That's a huge commitment for a private company to be willing to invest, and I think it's that kind of leadership. I met yesterday with folks at Philips that have already been at net zero and are thinking about ways to really tell that story and that leadership to be able to help other companies make that same transition and adaptation, and to talk about how that good business practice actually saves money and builds a better business going forward. Those kinds of examples are mission critical, I think, to transforming our world that for too long has been operating on shorter time cycles, really looking at how do we maximize profit for this moment. We cannot be worrying about the next election cycle or the next quarter of returns, because business's sustainability and future is entirely tied to our planetary and our human health. And the sooner we wake up to that, the sooner we are going to not only, do well, but we're going to do good at the same time. We don't have a choice. So I am asking you to all please think about how we rise to this moment and we set a different tone of legacy for going forward. Because honestly, it's not just about my children. I have an 8-year-old and an 11-year-old. I have an 8-year-old that couldn't fall asleep the other night because she's so terrified the earth is going to end. And the sad part is, my child still got to roll over and go to sleep in her safe bed in her adapted house. It's the same day that an entire city in Libya was wiped out by a flood from a storm that has been created by climate change. We are responsible for this. Make no question, every single one of us. So we are responsible also for changing it. And it's not just about my children or your grandchildren. It's about our lives tomorrow, because we are dying daily from what's happening in climate change. We don't have to, but we have to make different choices. We have options. This is not just doom and gloom, but it is choices, and it's choices we have to start making today, now.
So as part of that lasting message and seeing the clock tick to a minute here, maybe an example of what you're already talking about, how do we get out of that short-term cycle? Instead of going from an event to conversation, and making the action real and not just dialogue?
Well, I'm an ICU doctor, so I'm all about action, right? You got to go do it and get it done, and you got to do it quickly. It starts with making decisions and then really building follow-through and creating accountability. Some of it is metrics. The metrics that we measure need to be about health, and we need to integrate those into the global stocktake and into how we're measuring our progress in climate change. A colleague of mine very astutely said we shouldn't be measuring our progress in degrees Celsius, but in lives lost or in lives saved. And I think if we can start to think in those metrics, we start to create a difference in value chain that will make us more action-oriented. I also think we have a responsibility to really lean into the fact that this is a savings. We save money if we invest in resilient health systems, we invest in our health and well-being, we invest in our prevention, we invest in, the most important thing we do is every decision we make should be to reduce greenhouse gases, because those are causing the harm. We start there. We reduce the health sector's contribution to climate change. 5% of greenhouse gases are coming from the health sector, more than the aviation industry. And we invest in the adaptation and we invest in the resilience. We're going to start to save lives. You save lives, you get a more productive society, you get a tax base, you get more income, you get a more productive group of children that are actually can get better educated and can be contributors to society, and we spend less. India spent $9 billion alone managing its the cost of non-communicable diseases. We spent $50 trillion since 2010 managing the health impacts from air pollution. We are wasting money. If we invested that on the front end, yes, it might be a big capital call up front. We're going to have so much more savings, and I think that's a really important piece for people to understand, is that there's a whole different well-being that will happen. I'm minus 44 seconds now, though.
That's okay. I think we can continue this on for quite a bit of time, and I want to thank you for your time and passion, interest, and not laying out just the argument, but also putting human element into this, which is very, very critical. Let's thank Dr. Carey for her time.
Thank you.